Greetings. Uh, Let us learn about the importance of head and elevation and the role of alginates in the management of gastroesophageal reflux disease. These are my acknowledgements. So, it is important to share the principles of head and elevation in the management of gastroesophageal reflux disease, especially in patients who have nocturnal acid reflux symptoms and also in patients with hiatal hernia who complain of not only heartburn but regurgitation of food. So let us talk about it. So, say for example, you have a patient who typically eats a big fatty meal, rich meal, late in the evening, uh, along with uh, consuming a couple of drinks of alcohol, and then he's so tired he goes to bed within an hour after that big meal. What happens? When he lies down, the acid that has been secreted by the stomach tries to enter into the hiatal hernia sac, and from there, if the lower esophageal sphincter is weak or goes into transient lower esophageal sphincter relaxation, it reflexes up into the esophagus. So, what is the normal mechanism of clearance of acid reflux? Peristalsis of the esophagus and gravity dependent drainage of the esophagus, especially if somebody is in an erect position, and neutralization by salivary bicarbonate. These are the mechanisms that clear the acid from the esophagus. So, peristaltic wave, in this case, a secondary peristaltic wave stimulated by the acid reflux, clears it. But because of the hiatal hernia, it acts like a pocket which stores that acid there. And if the patient is still lying flat, there is a tendency for that acid to keep on reflexing back into the esophagus. How do we fix this problem? This is where keeping the head under the bed elevation comes, and that elevation allows gravity mediated clearance of that acid. And then as the stomach empties, the pocket also empties. The acid pocket also empties. So you understand from this the benefit of counseling your patient to have the head end of the bed elevated when he goes to bed if he has any nocturnal reflux symptoms. And also advise the patient to space at least 4 hours for the stomach to empty after the last meal before he goes to bed. If a patient is symptomatic despite being on a PPI therapy with nocturnal symptoms, one could consider using a drink of alginate, which forms a viscous raft which stays on top of that stomach contents and prevents these symptoms of acid burn to the esophagus. So we talked about the importance of head end elevation, clearance of the acid pocket, You want to tell your patient, if they have hiatal hernia, how this acid pocket that rises to the top, that is not neutralized by the food in the stomach, is going to cause them problems. And the simple trick of having the head end of the bed elevated, taking alginate, and spacing the last meal at least 4 hours ahead of time before going to bed, and also making that meal smaller for the stomach to empty, avoiding rich fatty meal, and avoiding alcohol late in the night. These are the principles that help patients do better. I hope this is helpful. Thank you.